Hi and welcome everybody. My name's Dr. Joe Cross and I'm a professor at a medical school. I want to show you how you can easily use ChatGPT to practice for your OSCEs if you're a medical student. First off, a couple of disclaimers. One thing is don't use ChatGPT uh, to get the foundational knowledge. You really need to have the foundational knowledge first, and then you can use ChatGPT to just practice your OSCEs. Secondly, I'm sure you're aware, but be aware that ChatGPT does hallucinate. So you need to, again, have that foundation knowledge so you can pick out when you're getting misinformation back from ChatGPT. And thirdly, ChatGPT cannot take the place of a real patient. You're not going to have the facial expressions or the emotional responses that a real standardized patient or a real patient would have. So be aware of that. And thirdly, and fourthly, it tends to um, give you perfect responses, which of course a real patient will not give you very perfect answers to every question that you have as a physician. One other thing is I don't recognize, I recommend using the latest version of ChatGPT, which is ChatGPT 4, for the simple reason that it tends to give less misinformation. If you don't want to pay the $20 a month for the ChatGPT 4, you could just use Bing, which I believe has ChatGPT 4 integrated into it, but I can't vouch for that because I haven't used it myself. Okay, so are we ready to use ChatGPT as a standardized patient? So let's go and take a look at um, what we have, uh, what I've done in terms of standardized patient work. Okay, so the first thing you're going to want to do is to upload or go to the Chrome Web Store and find an extension called Voice Control for ChatGPT. This is a free extension and it's easy to just include that into your Chrome browser. Once you've got the voice controls for ChatGPT installed as an extension, you'll notice you get a bar down the bottom here that has a little microphone on it. You can choose the different languages that you'd like to use. I'm just using US English for the moment. And when you want to talk, you want to click that bar and that will record what you're saying. And when you've finished, you're going to click it off. Okay, so I've already inputted the prompt for this standardized patient exercise. It says, you're a standardized patient, choose a random illness examinable by the USLME. You are to present with a complaint of a typical patient with that illness and respond appropriately to all my subsequent questions as if I'm a doctor. Do not mention the name of the illness. Okay, so once again, I have to caution that I'm not a medical doctor, so my differential diagnosis might be a bit strange here, but you'll get the idea of how it goes. Okay, so let's see what happens when I input the prompt, and I'm using ChatGPT 4.
Understood. Let's start. Good day, doctor. I've been experiencing an unusual numbness and tingling sensation in my hands and feet for the last few weeks. It's like pins and needles. I've also been feeling quite clumsy lately. I've dropped things, and it's hard for me to write with my usual finesse. It's like my hands just won't listen to me properly. Plus, I've noticed a strange stiffness in my legs and I find it difficult to balance, especially when it's dark and I can't see properly. I'm really worried because I've never had anything like this before. I've been generally healthy all my life, and these symptoms are very new to me.
I'm very sorry to hear that. Let me see if there's anything that I can do to help. First off, could you tell me, does these symptoms improve or get worse from any triggering activity?
No specific activity seems to make the symptoms better or worse, but I have noticed that the numbness and tingling sensation can become more intense when I'm at rest or trying to sleep. As for the balance issues, it seems to be worst when I wake up in the morning or when I'm moving around in low light conditions. I haven't found anything that alleviates the symptoms. I've tried over-the-counter pain medications and heat packs, but they haven't helped with the numbness and tingling. The clumsiness and balance issues have made me a bit fearful of engaging in activities where I might fall or drop things.
Thank you for that. Can you tell me, is there anyone in your family who also has similar symptoms?
None of my immediate family members have had similar symptoms, as far as I know. My mother is in her 70s and she has arthritis, but she doesn't have the balance issues or numbness and tingling that I'm experiencing. My father passed away from a heart attack a few years ago. I have 2 siblings and both are healthy. We don't have a history of any hereditary or neurological diseases in our family. I've always been the healthy one, so this is quite a shock for me.
I hear that you are feeling shocked because this is an unusual series of symptoms that you're experiencing. I want you to step out of your role as a standardized patient for a minute and tell me what the expected neurological examination results would be for a patient with your illness. Don't mention the name of the illness, please.
Of course. Here's what you might find on a neurological exam for a patient with this presentation. Decreased vibration and position sense. The patient might have difficulty identifying the position of their joints or perceiving vibration in their extremities, particularly in the feet and hands. This is due to dysfunction of the dorsal columns of the spinal cord. Ataxia. The patient might display poor coordination and have a wide-based, unsteady gait, which is particularly noticeable during heel-to-toe walking, tandem gait. Positive Romberg sign. The patient might lose their balance when standing upright with feet together and eyes closed, indicating a loss of proprioceptive control. Hyperreflexia. The patient might have brisk reflexes, particularly in the lower extremities, due to loss of inhibitory signals from upper motor neurons. Bilateral Babinski sign. A positive response, extension of the big toe, with fanning of the other toes, might be elicited, indicating upper motor neuron dysfunction. Impaired fine motor control. The patient may struggle with tasks requiring dexterity, such as buttoning a shirt or picking up small objects, due to loss of proprioceptive feedback. This, of course, would depend on the severity and duration of the disease, and not every patient with this condition may display all these signs.
Thank you for that. And now step out of your role as a standardized patient completely and tell me how I could improve my differential diagnosis skills, please.
Certainly. Here are a few strategies that can help improve differential diagnosis skills. Think broadly initially. When a patient first presents their symptoms, cast a wide net with your differential. This ensures you don't immediately hone in on one diagnosis and potentially miss others. Use a systematic approach. Develop a consistent and methodical approach to rule in or out potential diagnoses. You can organize your differentials by systems, cardiovascular, respiratory, neurological, etc. or by symptom type. Consider risk factors. Always take into account the patient's age, sex, lifestyle, family history, and other demographic or personal factors when formulating your differential diagnosis. Keep practicing and reflecting. Keep refining your clinical reasoning skills through practice and regular reflection. Consider each diagnosis you make as a learning opportunity, whether it was correct or incorrect. Continual learning. Medicine is an ever-evolving field with new research and discoveries. Keep yourself updated with the latest in your field.
Okay, so that's it. Good luck. Hope you do well with that. Be aware also that you can reverse the roles, so you can ask ChatGPT to present as a patient, and you can test out to present as the physician, and you can present with a particular illness, and that will really test out your knowledge of the illness that you're presenting with. Also, remember you can, let's say that you're doing something in global, you can change the language of the input and output to any of the languages that are available through that extension, such as Spanish. Okay, good. I noticed that there was a bit of sound issues. There seemed to be a TV or something in that screen whenever the ChatGPT was speaking. I don't know why. I've never seen that before, but you should not experience that yourself. And I didn't have the TV on here, so I don't know what happened, but it happened. Um, and I might redo this video with a bit of professional help once I get into that position where I'm able to do that. But for now, hopefully this is useful. Please comment if you find it useful in the comment section below, and good luck.